Hi, I'm Dr. Goh Kim Yen from Ampang Putri Specialist Hospital. I'm a general physician and I specialize in hematology as well. Leukemia is white blood cell cancer. Okay, this is a very unusual or rare condition. So the frequency of it is about 1 to 2 per 100,000 population. There are two broad families of leukemia. One type is what we call acute leukemia. Leukemia which progresses very fast and the patient may get worse very fast within a short period of time. There's another family of leukemia which is called chronic leukemia. So there are many causes of leukemia, but broadly it can be either comes from the body itself or it can be environmental factors. So environmental factors like radioactivity, contact with chemicals can be reasons for leukemia. So the others are actually within the person. For example, there is genetic change within the blood cells, especially the stem cells, which are actually present within the bone marrow. So once there is a genetic change, this may lead to different types of leukemia. A person with leukemia will experience tiredness. For example, they find it hard to climb a few types of stairs, and they find it excessively tired compared to their normal self. They may have easy bruising. For example, they may have blue-black marks on their skin, and sometimes they come with prolonged fever, unexplained fever. I would say that the signs for leukemia or the symptoms of leukemia can be very subtle. You will only know it or confirm it once you have a blood test. There are different ways of treating leukemia depending on what type it is. For example, some chronic leukemias can be treated with just tablets alone. But broadly, acute leukemias has to be treated with chemotherapy, meaning that drugs that are aimed at killing cancer cells. And these drugs are usually given by injections because leukemia is in fact a liquid cancer. So you have to give something that goes into the blood, circulate in the blood, and kill these abnormal cells. And I would like to say that leukemia is actually not the end of the world. Once you're diagnosed with it, there are many ways nowadays to cure it. Some leukemias are commoner in children, whereas certain leukemias are commoner in adults. For example, there's a type of acute leukemia which is called acute lymphoblastic leukemia. So this type of leukemia is commoner in children, and the chance of curing this leukemia is extremely high these days in children. And a lot of children get cured, they lead a normal life, and they grow normally to adulthood. Whereas in adults, acute myeloid leukemia, amongst the acute leukemias, acute myeloid leukemia will be commoner than acute lymphoblastic leukemia. So for adults, the principle of treatment is first, they go for injection chemotherapy, and certain type of leukemia, they have a higher chance of cure with stem cell transplantation. So specifically whether or not that type of leukemia needs a transplant, you need to talk to your doctor to find out.